A healthy female at any time in her life should have 10 times more testosterone in her body than she does estrogen. So this really changes the thinking about what are the important hormones. And one of the things we do when analyzing clinical trials over decades is we kind of stack them all up, clinical trials that have some similarity, and say, well, what are these all telling us together about a trend? So we call that a meta-analysis. And when you review women on hormone replacement therapy, different forms, whether it's estrogen and testosterone, estrogen alone, testosterone alone, estrogen, progesterone, testosterone, we can compare. And what we look at is the incidence of breast cancer, and it's typically quantified as the number of women who get it per 100,000 women years. So we do that meta-analysis, and very simply, in a lecture that I gave actually recently in Manila, Philippines, to show this information, women on estrogen replacement therapy alone, so this would be Premarin, and I don't even want to talk to you about eating horse urine pills, but that's different.
It's what it is, listeners.
Women on estrogen therapy alone have the greatest risk of developing breast cancer. Women on estrogen and progestin, so that's the medroxyprogesterone acetate or the Prem Pro, they have even higher risk. Women on estrogen and natural progesterone, well, they have lower risk than both of those two groups. Women on estrogen testosterone or estrogen progesterone testosterone, anytime you add testosterone, you dramatically reduce the risk. And in fact, women on estrogen, progesterone, and testosterone are shown to have breast cancer risk consistent with women who don't even use hormone replacement therapy at all. So we talk a lot about hormone therapy, about being in proper balance. You don't want to have too much estrogen. Well, you don't want to have too little because it protects the brain and the bones. These are, again, the things you might not necessarily feel, but what you and I have talked about before is don't forget about testosterone because it is the balancing hormone and actually more abundant and maybe more important in the female body than estrogen.
Exactly. And I think that, too, it's important for listeners to know that this big scare with breast cancer and it's being in breast cancer awareness, and we really want to educate our listeners how hormone therapy can be done safe. Most people that are diagnosed with breast cancer, 80% of them have never been on hormone therapy. So that risk of being out there, and it's really just getting treatment and getting the treatment right. And like you mentioned, Robert, having your hormones in the right ratio. It's not about just getting on estrogen or just going and getting on progesterone or your testosterone levels. It really is a science how it's done. And so many times I have listeners come in and say, well, I've been to my primary care, I've been to internal medicine, I've been to OBGYN. They tell me to get off these hormones. And it's from the old research that's out there, and yourself and myself were up to date on them, treatment plans out there, and really been into the research on breast cancer and hormone therapy, and want our listeners to know that it's more than just getting on that.